Hi, my name is Steven Simplegard, and today I will be doing the validation for the Ivpb. First thing I'm going to do is come into the room, close the curtain or close the door for patient privacy, wash my hands, put on some gloves. I'm also going to introduce myself to the patient and explain to them what I am going to be doing, which is be administering medication via IV. So I'm going to get to my patient. I'm also going to check the patient's identification with 2 forms of ID. First, I will actually lift the bed up. So I'll check the patient's ID, 2 forms of ID, either first and last name and the date of birth. I'm also going to assess their IV site for any patency or any sort of infiltration, phlebitis, making sure everything is perfectly fine. So that is good. Next, I am going to grab the medication. I'm going to check it to make sure it matches the MAR for the doctor's orders and it matches the patient's name and everything. Do that. And I'm also going to follow the 6 rights of medication for the patient as well. So, first thing I'm going to do, I'm going to get my lines, my supplies, get this guy out. Do. Also hang this up here so we just have it ready. Check my line, make sure everything's good. I'm going to get this ready, again checking the medication a second time, making sure it's the correct one. Remove this cover. Going to penetrate. Making sure this guy is closed before I turn it upside down. Going to hang him over here. Checking the 3rd time for the medication, making sure it matches everything. Alright, put this over here. Take this off. Open it up. Prime this first as well, about halfway. I'm going to open it up just to make sure our lines are good. Make sure not to waste too much. No air bubbles. It's good. For now, I'm going to close this back up. Okay. So what I'm going to do is scrub this hub over here before I connect the IV for 15 seconds. Okay. So open this back up. Twist. I'm going to open up this completely. And now I am going to actually regulate the drips per minute. Doctor's orders are 20 drips per minute. So we're going to do 5 drips per 15 seconds. So I'm going to slowly open it up. Before I do that, let me hang this guy lower. Open this quick.
Turn and wash a little bit, Steve. Thanks. The glare.
Too fast. So we're trying to get that 5 drips per 15 seconds. 2, 3, 4. 5. So we're just gonna do a whole minute just to make sure. looks like it's going for 20 drips. Alright, so that's it. So what I'm gonna do is again check on my patient, make sure he's alright. I'm gonna lower the bed down. Document everything in the patient's chart. I know. I'll also come back after this medication is infused, depending on how long it will take, maybe an hour or two. Come back, I would also reset this back to the actual original fluid that is being infused. So I'm going to come back, raise the bed back up, and I'm going to discontinue the medication. So what I'll do is disconnect. Medication. Restore this back to its original height and return this solution to the original drip factor. Once I'm done with that, assess the patient's IV site again, making sure nothing's going wrong with it. Lower the bed back down. Record everything in my INO, any sort of findings or anything like that. Also, discard of my dirty gloves in the trash, wash my hands, and that is it.